Stephen F. Eckel is the Associate Dean for Global Engagement at the UNC Eshelman School of Pharmacy. He is also an Associate Professor in the Division of Practice Advancement and Clinical Education. In addition, he is Director of the 2-year Master of Science in Pharmaceutical Sciences with a specialization in Health System Pharmacy Administration. At UNC Medical Center, he is Residency Program Director of the 2-year program in Health System Pharmacy Administration.
I am very humbled to receive the 2023 APHA Foundation Pinnacle Award for Individual Career Achievement. The medication use process forms the foundation of my research, as well as my approach to education within the pharmacy school. My personal philosophy is that I firmly believe that the pharmacy department, which is comprised of pharmacists, pharmacy technicians, as well as support staff, that group should be accountable and responsible for the entirety of the medication use process. That includes both acute care as well as ambulatory care. When I make that statement, many times I get challenged about, well, we don't prescribe, we don't administer. Maybe dispensing is something that we can be responsible for, but those other steps are the responsibility of others. While I understand the idea behind that sentiment, my personal belief is that while we might not do those things, we are responsible for the system in which they operate. So how medications are prescribed, how medications are administered. And we can ensure that those systems are cost effective, they drive appropriate outcomes, they minimize medication errors, things that pharmacists are well positioned to take leadership over. And when you begin thinking through it in that realm, you can see why responsibility becomes something that I believe is important for the pharmacy department. Now, the other thing that I challenge my students is we don't want anybody to practice pseudo-pharmacy. That might not be a term you're familiar with, but the concept is we can say one thing, we want to do this, but in reality, we don't do it on every patient. We don't do it every day of the week. We don't do it every hour of the day. And when there's that mismatch, that's when you begin practicing pseudo-pharmacy. And so as we approach responsibility for the medication use process, we also need to ensure that what we're committing to is always there for the patient. There are also a lot of people that I can thank for this award. First of all, I've been fortunate that the entirety of my career has been spent at both UNC Medical Center as well as UNC Eshelman School of Pharmacy. I firmly believe there is no better environment in which to practice, research, and innovate. In addition to that, I've had a variety of different mentors who have invested in my own personal development. The first one I'll mention is my father, Fred Eckel. He's been there from the beginning, encouraging me, challenging me, and when I really needed help, giving me guidance on what I should do. The second individual is Jim McAllister. When I did my residency, he was there, and then he was my first boss at UNC Medical Center. He's believed in me, but he's also created opportunities for me to grow, develop, and flourish. But beyond those two individuals, there's many other colleagues that have come in and out of UNC that have also provided different roles of encouragement, challenge, and growth. I've also been fortunate to work with many, many residents over the years that I've been able to see to grow, develop, and take on jobs around the country. But even though as I've invested in them, they've also challenged me by the way they've asked questions and just observing how they approach problem solving. And I've been able to learn from them and apply it to my own professional development. I've also taught many master's graduate students who've gone on and have responsibility and accountability for the medication use process around the country. And I've always challenged them, make sure that you don't practice pseudo-pharmacy. I'd like to provide a special thanks to Bob Granko and Tyler Vest, who nominated me for this award, and individuals that I've collaborated and had as friends over the years. As a longtime member of APHA, it is always gratifying to be recognized by your peers, and this honor provides energy to keep fighting on improving the use of medications in all practice sites. because our patients deserve much better than what they have today. Thank you.